Hello, everyone. So we will be starting our session now. I first want to welcome you all. Welcome to today's webinar on planning and implementing research with Syrian refugee populations on sexual and reproductive health, mental health, and family planning services. I first want to thank you all for taking the time to join us today. My name is Dalia Sariyuddin, and I'm a project coordinator within the Refugee Health Program at the Global Health Institute at American University of Beirut. And I'm happy to be your moderator for today's webinar session. We're honored to have two expert speakers with us who both work closely with RHP at GHI and who I will be introducing very shortly. First, allow me to provide a brief overview of today's session. So we will begin with a general introduction to the session, then move on to explore participatory approaches in research, including their significance, strategies, types of participation, and some key challenges. The second part will shift focus to ethical considerations in research with refugees, covering vulnerability, ethical frameworks, and guidelines, and the asymmetry in power between refugees and researchers. Finally, we will wrap up with a Q&A session for further discussion. And I would like to emphasize our interest in having an engaging session. So I would like to encourage you all to utilize the Q&A box to type in any questions or comments that you may have throughout the session. And we will be compiling your questions and our speakers will address them during a 15-minute Q&A session at the end. In addition to that, and to further promote engagement, we will also use poll questions to gather your input on the discussed topics. So I would also like to encourage you to participate in the polls that we will be launching throughout the session. Now, before we dive into the main content of the webinar, allow me to briefly introduce you to the Refugee Health Program, RHP, at GHI. RHP was established in response to the protracted crises in the Global South, along with their significant impact on the health and well-being of displaced populations and their host communities. Hence, our primary objective at RHP is to consolidate academic and practical efforts to explore the impact of these crises on refugee health, while also promoting capacity-building initiatives and tailored interventions to address their needs. In addition to this, and as part of our ongoing commitment to maintaining dialogue with experts in relevant fields, we have organized a series of webinars under RHP, and today marks the first webinar session of this series. And it will focus on how we plan for and conduct research with refugee populations. Now, I'd like to also emphasize that in the interest of accurately representing refugees, we are using the term refugee to refer to individuals who were forcibly displaced to find safety in another country due to conflicts or ease of reference. However, we do recognize and acknowledge that this term may hold other social and legal connotations. So without further delay, we will now start with the first segment of our session, focusing on participatory approaches in conducting research with refugee populations. Please join me in welcoming our first speaker for today, Dr. Tanya Bosky. Dr. Bosky is a clinical psychologist holding a doctorate from Queen's University in Belfast in Northern Ireland. And she is also an assistant professor at both the American University of Beirut and the Trinity Center for Global Health at Trinity College Dublin. Dr. Bosky is also a specialist in child and adolescent mental health during adversity, with extensive clinical experience in Northern Ireland, Palestine, and Lebanon. Her research work is mainly focused upon improving the evidence-based and accessibility of mental health and psychosocial interventions. Thank you, Dr. Bosky, for joining us. The floor is yours.
Thank you very much and for the lovely introduction. Nice to see everybody here, and I look forward to some interesting discussion. Before I start talking about participatory approaches, we thought it would be a useful idea to get some idea of what the audience has experienced before and what your experiences so far are with participatory methods. So we're going to jump to a poll, and Dalia will help me with that. We can't see it, Dalia.
Yes, I will be launching the poll very shortly.
Okay, thank you. the idea of the polls, we just have, I think, 3 questions to get a sense of who the audience is and what you've experienced before in terms of participatory approaches, and then we'll have more chance to discuss through the Q&A. Thank you, Daria.
Dr. Bosky, if you want, you can start with the introduction, and we'll be launching the polls while you are introducing the first section.
Okay. Great, thank you. So firstly, I will give a kind of definition around what participatory approaches is, or how we're going to think about that in this webinar, in that it's not a single method, that there's a huge diversity out there of what a participatory approach can be, and how many methods and activities and ways in which we might be participatory. This is therefore more of a meaningful process of partnership. That's an important distinction from just being a tokenistic approach or method, that this is a process, is a relationship and a partnership. So participatory approaches can include a range of different stakeholders. People with lived experiences are a really important part of that. It can also be other community members around the target population, professionals who have frontline experiences and may have insider knowledge around how systems work around that population. So this can be really useful for lots of different research, and I'll be interested to hear about your experiences. My work has predominantly revolved around intervention development and evaluation of interventions, and participatory approaches have proved extremely useful and essential part of that. Lastly, different methods can be needed at different times, and I'm going to try and use some different examples from when in projects different methods have been useful. Next slide, sorry, Daniel.
Yes, so we have launched the polls. If you would like to view the results on the screen.
Sorry, I can't see it. There, okay. I see poll 2. So the question was, have you used participatory methods in any of your work before? The majority said yes. So there's 75% said yes. So I hope that we can have some discussion around what approaches you have used in the past, and how that relates to some of the challenges that I'm going to raise in this discussion, specifically for working with displaced populations and refugees, and specifically in the region and with Syrian refugees. Third question, if you have used participatory methods, when have you started the involvement of the target stakeholders? Can't see the answer yet. I guess you're still voting. Shall I move on, Dalia, while people are voting? I know it's popped up. Great. So the options before developing a proposal is around 50%. I think that's probably a non-representative sample here. That's fantastic. At the beginning of a project, around 20%, midway the same, and 10% at the end. And we're going to talk a bit about when it's important to include participation, but earlier the better. And we see that the majority of you have been able to do that, which is fantastic. So we'll come back to that discussion. Thank you for that. So I thought it would be helpful to start with challenges from experiences from various different projects in working with Syrian refugee populations and ensuring participatory approaches through research, so that we can then map that against the best practice kind of guidance and literature to see how we can better improve our participatory methods. And then I've also got a few examples as well. So firstly, in terms of challenges that we have experienced in our work, one of the main things is that populations are by their very nature on the move. And so we've experienced many people who were part of participatory approaches that have had to move either internally because of evictions or because of finding work or other reasons, but also externally to the country where they've either been resettled or have left the country by other means. And so that can be challenging to maintain. It's challenging for research in general, but particularly for participatory approaches that are so a longer term, continuous, that require the maintaining of relationships, and that can be quite challenging in a rapidly changing community. We've also had the challenge of starting early, as we've just identified. Many of you have been able to do this, but it's a big challenge when funding is often only available after a research proposal is written and funded. A lot of things are set in stone by that point, and it can be very tricky to find funders that have seed funding or other ways to build participatory approaches early on to inform the proposal itself. Other major issues around humanitarian disasters and the worsening insecurity that refugees and researchers face is a massive challenge, particularly here in Lebanon, where there really has, over the last 4 years, been one thing after another that has made transport difficult, that has taken over people's ability to move, to work, to access internet, to access electricity, and so on. And that can make it very, very challenging for research in general, again, but also for maintaining relationships and building those participatory approaches. Another thing that's really crucial, once we have that kind of approach set up, the method set up, is ensuring that the voices that are coming through from communities are weighted in decision making, that it's not just a consultation, but that the actual voices are translated into decision making, into structural changes, addressing those kind of critical points, rather than being overridden by experts or researcher professionals in that area. And that can be quite tricky, particularly when there isn't a common language across different people, where maybe English is a dominant language amongst professionals, and it can be hard to mix groups together in say, one workshop. And so if there's a representative of the community voice, that can get washed out quite easily in an intimidating professional environment. So that can be quite challenging to ensure, as well as ensuring not coercing, but also respecting the time of participants in participatory approaches, where there is some monetary, at least, compensation, to really respect the time, that this is not exploitative, but at the same time, not coercing somebody to take part in something that they may not otherwise have done. And that can be a really tricky balance in my experience. And ultimately, what that is really about is about power, and not being neglectful of the potential for power to impact on this process, and to address it early on to make sure that it's an equitable partnership. So those are some of my kind of main challenges that I've experienced working in this population for a long time. When we go to the literature, you just go to the next slide, please, Dalia. The main question when we zoom out is about when we're thinking about participation, asking who should be involved, why, when, and how. And I'm just going to work through all of this in terms of best practice guidance that is available with some examples. So firstly, when we think about who should be included in a participatory approach, that can be very broad, because the target population may be diverse in many, many different ways. And we need to be mindful of including all of that diversity to reflect the voices from different parts of the community in our work. And that can, for example, be a mix of genders, of ages, but also of neighborhoods and camps. In Lebanon, there's a major difference between the experiences of people who are, for example, living in tented settlements versus in urban housing. Not necessarily better or worse, but just different. And that difference is really important to reflect in our work, and it will have an impact on our research, and particularly in the context of intervention development. Also, we need to make sure that we're able to include those who may actually be critical of the work that we're doing, those who maybe have dropped out of programs or have rejected the work of others in some way, or where there's poor attendance, that we don't tend to have an unintentional selection bias in which we will pick people who are likely to have enjoyed our work and to have to acquiesce maybe to some of our views, but that we really make sure to include people who can voice concern or criticism of what we're doing. We're likely to create something much more contextually, culturally relevant. In terms of adaptations, we need to make sure that we're able to create as universal a design as possible in order to include people, say, with disabilities or people who are on the move, in order to not unintentionally exclude people on the basis of some characteristic. And then lastly, we need to make sure, particularly in the context of Lebanon and tented settlements, that we consider the community unit, where there are often formal or informal authorities like Shawish, that can very much have an influence on how or when communities might engage in participation. And so that's a really important addition to think about the community, not just the individual to be approached. So in terms of when, you all have clearly experienced in early participation, either before the start of a project or intervention or at the very, very early beginning. And that's really important for meaningful participation. Research has shown that most participation actually occurs often at the very later end, sometimes at the end of a project, or consultation during, when all of the kind of structural decisions have been made, the research questions have been set, the design has been set, the population inclusion and exclusion criteria has been set. And so it's very hard to make any structural changes at that point. And so it's often more of an evaluative participation rather than really structural or transformative. So that's really important. That early participation is important to really enhance contextual relevance of the work that we're doing and the research questions that we're asking and the prioritization of research questions, because we are able to get communities to guide that process early on rather than just consulting them on it afterwards, or asking them within a very strict boundaried frame. And also it improves our continuous engagement with our participants, as qualitative interviews and consultation with target communities, although very useful, is really unlikely to get that meaningful participation when it's just tagged on at the end. If we're able to get that continuous engagement from the very beginning, and we're able to build the relationships early on. Dalia, sorry, could you go to the next slide? Thank you. So if we move to how, there are a million different hows, and I'll try and touch on some of them. But what I felt from experience and from the literature is what's important is about relationships, the building up of relationships, breaking down barriers between academics, researchers, professionals, community members, target populations, children, and so on. So the essential thing for meaningful participation is the building of these trustful relationships, these mutually respectful relationships. And that this approach really needs to then weigh community voices to make sure that they are not overridden by the kind of experts, that experts by experience are just as important and need to have their voices heard, and that can create structural changes. So this kind of parachuting approach to participation, where there's just the odd one-off consultation, is very unlikely to give space and time for building these kinds of meaningful relationships. So now we move to how, and there are, again, many different hows, but I've just picked on some very commonly used ones and ones that I have used in my work that I found to be really effective ways of creating meaningful involvement. Firstly, in terms of youth or community advisory boards that include the target population and that have a formal structure around them, a formal system, in order to make sure that there's a continued engagement and there's an opportunity to build relationships. And that can be made up of a really representative mix of the stakeholders, depending on the context of the project. I'll give an example of that in a second. Professional advisory boards can also be important for participation. It's not just about people with lived experience, but also others that might be able to give an insight into how a system or a structure or an intervention might work. And so professional advisory boards can also be really helpful, or a mix or a combination or integration of both. And this can also include things like key informant interviews to make sure that we acknowledge and incorporate frontline experiences into what we're doing. And again, I'll give an example of that in a second. Another possibility is through capacity building, where there's really more of a longer term approach to building capacity, empowering communities to be able to lead rather than only inform research. So they may be able to make their own transformative changes within their communities. And lastly, co-design activities or co-development activities, again, where there's an attempt not to consult, but more to work in partnership with communities. So that can be in one part of the study or the whole study overall. For example, prioritizing research questions or identifying research questions co-developed rather than developing the research questions and then just checking whether they're valid with the community. And I just wanted to put this in the broader context. This is a table adapted from a UNICEF frame for participation with children, and really highlights the different types of participation. Of course, there's lots of different methods within here, but in terms of the aims that can largely be clustered within these 4 different categories, starting from nominal, where there's this more tokenistic. The aim is more around just demonstrating stakeholder involvement rather than a meaningful engagement in which there's an opportunity for any actual decision-making or change, right up to transformative participatory approaches that aim more to support and enable the target community to make decisions and act for themselves. This is more the co-leading of projects or co-authorship, for example. And then in between, instrumental and representative approaches that may not be fully transformative in the way we might like to be, but still are far more than nominal, where there's an attempt to make sure that what we're doing is relevant to the community, for example, to improve buy-in from communities and to address fairness and to make sure that voices from communities are represented in the work that's being done. So I wanted to give some examples. I have 3 examples of participatory approaches from different projects using different methods. And the first one is from the family intervention that we developed here in Lebanon for at-risk adolescents and their families, including and predominantly Syrian refugee families. And we included as part of the intervention development very early on a community advisory board that was made up of adolescents and of their caregivers. And we met monthly from the very beginning, right through the entire project. And they informed key decisions. We ensured that their voices were weighted in decision-making, particularly when there was any kind of disagreement, that the community advisory board voices would weight in that direction. So, for example, they very much influenced the structure of the intervention, the setup of sessions, the location of sessions, but also the content of the intervention itself. This image that became the logo of the intervention was very much influenced by the Community Advisory Board, the idea, the metaphor of a tree that became one of the activities to ground the family at the very beginning in terms of their own strengths and goals. And this was very much influenced by the Community Advisory Board, as well as the order of the types of components that we wanted to include, the relevance of ones over another when we're making decisions about what to include that will lead to the outcomes that we're looking for. So this was an example of a Community Advisory Board. I'll give you now an example of a youth advisory board that was used for the PhD of Salam Jabour, and I have an image credit for her here in terms of her eco-mapping. So she has consulted with communities very early on in her work before having developed her full proposal. So a nice example of extremely early engagement with communities to inform the intervention planning and the existence of the intervention altogether. The idea for this was around having identified through other work that there was a high level of community isolation in Lebanon, the same community of Syrian refugees living in Lebanon, and the need then to address this community isolation, but finding a way to do that. So even the definition of community was done through a participatory approach through this eco-mapping. And so the Salam has here mapped out her the community of the participant using this approach to even define who is in the community, what services are in the community, where are the strengths, where are the risks, and how might we be able to strengthen this community around the young person. And the Youth Advisory Board will then be involved at every step in terms of the actual intervention development, what the intervention will actually be like, what it will include, and how it will be delivered. And my last example is from the SEEK trial, which was an intervention between that integrates sexual and mental health. And we used key informant interviews with professionals from both sexual health and mental health very early on in the intervention development in order to balance the two approaches, very different areas that we knew were important and were integrated as part of this intervention. But also to balance the community voices that had been integrated earlier on with existing evidence-based practice and concern that we might have from the more technical side. So to give you an example of how important this became, one of the issues that we had was around our main outcome of self-efficacy. This was about improving family planning, self-efficacy. And so a large component of the intervention related to assertiveness training, communication training, which makes a lot of sense from both a sexual health point of view and also a mental health point of view. But one of the issues that we realized coming up through key informant interviews was around the risk of teaching assertiveness to women who may be at risk of gender-based violence or currently experience gender-based violence, that we might increase the risk if they are then being assertive in that unsafe situation. And so that very much changed the way that we did our training and included additional components in the intervention to address unsafe use of assertiveness and how to keep yourself safe and to connect to other services when that might be a risk. And so that was really important to integrate that component into this intervention. Okay, I hope those examples were useful. I'm very happy to discuss more, and I hope that you also have your own examples. Just some take-home messages. The main thing that I wanted to convey was around how diverse these participatory methods can be, that they are very different for different projects, different populations, different age groups, but they are very much feasible when working with refugees. And even in difficult humanitarian context and with displacement. And the main thing that's important, the theme across all of this, is about building meaningful relationships that address these power imbalances. And that's really essential for these equitable partnerships. And lastly, that this kind of participation that includes this representative and transformative approach can actually improve, and has been found through research to improve the quality and impact of the research that we do. Thank you.
Thank you so much, Dr. Tanya, for this insightful presentation and for sharing those interesting points on participatory methods. For all attendees, I would like to remind you to type in any questions you may have in the Q&A box, and the speakers will address them at the end. Now, please join me in welcoming our second speaker for today, who will be discussing ethical considerations, Dr. Viloshni Govender. Dr. Govender is a scientist in the Department of Sexual and Reproductive Health and Research at the World Health Organization, WHO, in Geneva, with expertise in health economics and health policy and systems research. Dr. Govender also leads a diverse portfolio of activities on sexual and reproductive health and rights in health systems and universal health coverage. She also holds an honorary associate professor position at both the University of Cape Town as well as the University of KwaZulu in South Africa. Dr. Govender's extensive professional backgrounds also includes notable roles at the Alliance for Health Policy and Systems Research at WHO Geneva, as well as at the Health Economics Unit and Indian Institute of Management in Bangalore. Dr. Govender, thank you for joining us today. The floor is yours, and I can launch the poll at the beginning if you would like that as well.
Thank you, Malia. Yes, we can do the poll now. That'd be good. Great. We can move to the first slide then. Okay, so we can have the poll is up. So the poll, the question is, in which areas have you encountered ethical challenges in conducting research among refugee populations? And you can select more than one option. There's multiple choices, so you can select more than one. So I think the Tanya's really set it up really well in terms of the context of refugees and conducting research in such contexts. And I think the overriding issue, obviously, is that we're working within a context of extreme vulnerability and intersecting vulnerabilities. And the close and the poll is open, so we can just look at that quickly. So areas which you've encountered ethical challenges, more than half have been indicated issues with informed consent, as well as inclusion of participants in the research process. I think that speaks a lot to Tanya's discussion as well. Also important are questions around, quarter of you mentioned confidentiality, and about a third identified protection of researchers do not in place. Okay, that's excellent. And also fulfilling post-research obligations, and a third. So I think essentially, all of the issues that we listed, and of course they're not exhaustive, have been identified as challenges and often many of them are happening at the same time. And I think this also highlights the question around the context of vulnerability. These essentially relate to the fact that refugees are living in host countries where they may not be citizens, which means that they have fewer legal rights as citizens. Also, what we know is that they often hosted in many low middle income countries, and the context are not so different from their home countries. So, or the populations are not so different. So in terms of economic opportunities, etc. So challenges of discrimination, xenophobia are also important. They've also experienced trauma, which are often the reasons why people may have fled because of reasons of war, violence, and experience of trauma often multiple and can continue even once there's been displacement. And given often the economic challenges in terms of livelihoods being disrupted, and all of those, they also face food insecurity, lack of water, lack of shelter, contributing to issues around malnutrition. And obviously these are most often acute for children, but often what they're also facing are multiple health needs, interspersed with that are also including sexual and reproductive health needs and poorer health outcomes. So often we have intersecting vulnerabilities, which really heighten the challenges that refugee populations face as opposed to other populations in other contexts. The next slide, please. So ethics in research, it has become more important, particularly around refugees, probably over the past 15 to 20 years, especially given the magnitude of populations that are on the move. And we've seen a huge increase in this, especially more recently, even over the past couple of years, which necessitates why we need to consider ethics more importantly right now. They are, and just in terms of context, the initial ethical guidelines started with the Declaration of Helsinki in 1964, and this later informed the CIOMS guidelines, the International Ethical Guidelines for Biomedical Research involving human subjects. This has also extended to also include ethics for social science as well. The CIOMS guidelines, which has been more recently updated, does make reference to refugees in the context of Guideline 50, where it speaks specifically to vulnerability, and indicates that when vulnerable individuals and groups are considered for recruitment in research, they should be ensured that specific protections are in place to safeguard their rights and welfare. So the focus very much is on protection, the dignity, rights, and welfare of research participants. And of course, these are much more acute in refugee settings, and again, heightened within humanitarian contexts. So the guidelines provide for us the procedural ethics that researchers are required to follow and to ensure that they do put in place, and to minimize the harm to minimize the harm to participants. And this includes questions around considering the design, the sampling, how the methodology, how participants would be recruited, as well as also thinking about data management practices to ensure confidentiality and safety of participants, but also increasingly asking a need to recognize what happens, to also consider the post-intervention or the post-study stage. Once the research is complete, how is data shared, how are results shared, and how is that of a wider benefit to the participants? The next slide, please. And again, the question around researchers and research participants has been an ongoing one, and that is really the cornerstone of ethical issues when we're looking at the practice of research, and recognizing that there is an asymmetry in power between researchers and research participants, This is much more acute when we consider refugee populations. And there is an absolute need to understand why there would be, there is a need for potentially even additional guidance that goes beyond what currently exists. There was a very interesting, useful paper that I looked at when preparing for this webinar. That was a scoping review on ethical issues in research with refugees. And just to report, one of the important things I think that I learned from this paper and much of the work that I've reviewed and in over years is there is often a not necessarily, well, let's say a gap between what is procedural ethics and what tends to be kind of really straightforward, and what we can strengthen through the inclusion of IRB or ethics review boards and peer review. But in the practice of research is where we often do have the challenges that arise. And often these again are arising from the asymmetry of power between researchers and the participants. The question around informed consent, Tanya also spoke of coercion. How do we ensure that participants are compensated for their time? The question around incentives and the ethics around incentives, but at the same time being cognizant that participants, refugees especially, are often in very economically vulnerable situations. How do we engage with study participants? We know that besides parachute research, there is also the danger of certain research sites being over-researched, laboratory kind of captive sites for research. And unless participants or the communities themselves are engaged in the research and in terms of identifying what are relevant questions, we may have questions that could be answered through different processes, maybe even through a review. So there is, I think, in the questions of relevant of research, I think there's also probably a role for IRB boards to request that there is adequate research review that's done of what's existing research, what the gaps are, and if the questions then remain relevant within the wider literature. And the questions are also around the dual imperative. One is that research should be both academically sound and policy relevant. And there does not necessarily need to be a trade-off between the two. If research is academically sound, the methods are sound, there's adequate and consideration of how we are more inclusive. This itself may address many of the ethical challenges that may arise. And also in the context of refugees, and I think increasingly in humanitarian settings where there's acute emergencies, there is also pressure for research to be done more quickly, more efficiently, and to be able to share the results. But we have then the challenge of time versus being more participatory and inclusive. And again, these are issues that we need to be more cognizant of, particularly in these contexts, as well as how do we engage the communities more meaningfully, as well as how do we engage in terms of dissemination of findings. And one is dissemination for the broader policy stakeholders, whether these are for humanitarian agencies, donors, ministries of health, but also what is relevant for the participants, those who have engaged in the research, those who may have themselves been participating in the research and the conduct. And how do we ensure that, and how do we share the results with them in a way that is easy to understand, but that can translate into potentially benefits beyond the research itself? Can you move to the next slide, please? And I think in the, again, in the context, particularly around humanitarian work, displacements of population, and displacements of population, there has been increasing guidance that has been trying to address the gap in ethics, particularly looking at both from a procedural perspective, but also in terms of the conduct. And here I've just listed from MSF itself, Médecins Sans Frontières, They themselves are now more engaged in research, but also have then obviously identified the need for an internal ethics review board and frameworks that can guide their work, particularly in humanitarian settings. And some of the questions that or issues that they expect protocols to address are: one is importance, relevance of the question, the level of community engagement, not just from as in passive participants, but are also actively engaged in the research design, from conceptualizing of the research question to dissemination, being very, very mindful and intent in terms of identifying what are the risks that even researchers themselves might be exposed to. And I think particularly in contexts where researchers themselves may be from the community itself, and particularly also recognizing that some of the subjects and the topics that are being researched are highly sensitive, and that the researchers themselves may need debriefing after and potentially care themselves. And also ensuring that both there's adequate respect, protection for participants and communities, particularly in terms of safeguarding both the information that they're collating, how the information and how the research itself is communicated more widely to in terms of both the wider community as well as for other stakeholders. And again, coming back to the question around the use of incentives and balancing that against what may be of beneficial and might be of benefit to communities and participants themselves, and recognizing the extent to which it may be perceived or could be coercive. Next slide, please. Just speaking to some of the one of the areas, and of course speaking to my own area of work in sexual and reproductive health, is recognizing that particularly for women and adolescents, those who are migrant and refugees, are much higher risk of sexual and reproductive health, both in terms of their needs, but also in terms of some of the risk in terms of rape, unwanted pregnancies, sexual violence. And as a result, they also tend to have a much higher risk in terms of mental health needs as well. Research from specifically from the Rohingya refugees in Bangladesh, and there's been some ongoing work around supporting their sexual and reproductive health needs, has also tried to look at what are some of the ethical issues that have that come up and how these potentially can be addressed. And I think these obviously would be relevant across different settings. Some of the issues that come up are particularly in the context of sexual and reproductive health, but also recognizing the cultural, religious context in which these discussions happen are particularly sensitive. Also questions around how do we engage and how do we support participation of those who are engaging in the research to be able to take part, is being flexible in some of the methodologies. So being able to engage with people in their homes as opposed to in facilities. Also being cognizant of how do you ensure confidentiality, privacy, respect, what questions can be asked, what questions cannot be asked, but also requiring and putting the onus very much on researchers themselves to undergo and understand what are the cultural context in which they're working. Tani early noted the question around language. Also, what is the extent to which there is the ability of if the research team is carefully selected with the community themselves right at the start. This may address many of the issues and can itself build trust and cooperation between the researchers and the refugee population themselves, but also ensure that the conduct of the research happens in a way that upholds the safety and the protection of all participants. The next slide, please. There have been more, increasingly more guidelines that are being that are being developed to address some of the very specific issues around certain areas. So, for instance, I've just also included here ethical considerations in research on female genital mutilation that was published quite recently by the Department of Sexual and Reproductive Health, to potentially and also to identify what are the specific challenges for FGM. And also these also include thinking about what is the potential, especially when we're looking at very populations where there has been a history of trauma, which can be ongoing, is to also identify what are the measures, the interventions that can be put in place to mitigate the risks of, for example, re-traumatization of participants. And this is, for example, identify what may be referral services, follow-up services, but also being able to, again, at the very outset, through engagement with different stakeholders, including the communities, identifying what may be and what are the other services that need to be in place to ensure that in the conduct of research, we don't do more harm than what was intended. Next slide, please. So final thoughts before we turn over for questions is I think, again, recognizing that we're working, when we're looking research on refugee populations, is engaging with very vulnerable populations. There are limitations in existing guidelines, and there may be a need for more specific guidelines that have to be adapted for these specific contexts. And that we also have to pay attention to strengthening both the procedural aspects of research, but also the very practical aspects of research. And this has to be a very iterative process. I think, again, maybe this is a question for how, in terms of how we conduct and how research is also being funded, is to recognize that we have to have much longer timelines, for one, particularly to ensure that we are more flexible. These are populations that are potentially on the move. And then our research processes have to be more flexible and adaptable. And the next slide, which I think should be the final slide. Finally, I think then, through the review of what's been published in this area, there is insufficient, I think. There's more work that potentially be done in terms of updating IRB guidelines, ethic reviews, etc. But there's very little, I think, that's coming out in terms of actually researchers themselves, including with research participants, actually sharing some of the ethical issues, ethical challenges that's happening from the ground. And I think this would be extremely important. One is to share with the wider academic community, but also for policymakers as well, to better understand what are the ground realities in implementation and in terms of the ethical issues that arise. I think that should be the last slide, and then over to you, Dalia. Thank you.
Thank you very much, Dr. Govinder, for your enriching insights. I think it's highly important to address the issue of ethical considerations in the context of research with refugee populations. We do have a few questions from our attendees. I will direct questions to both speakers. First question is from Mustafa. How did you manage to persuade refugees to prioritize sexual health and family planning alongside their other pressing concerns like safety, food, economic situation, as participants in the implementation research or as health interventions in general?
Maybe respond to that really important question based on just experiences of the SEEK trial and having touched on sexual health through that. Firstly, I completely agree with the pressing concerns, these concerns around particularly the economic situation. When we started the trial, it's just 2 years, not even into the economic collapse in Lebanon. So these are major pressing concerns, and I don't think there was an attempt to persuade at all the community to shift their priorities elsewhere, because this is a major concern. Sometimes there are limits, though, in terms of what we have power to do. And so that's one of the sort of boundaries around what we can and can't do, but we can try to connect people. So for example, having really established relationships with cash transfer programs or organizations in which we can refer people when we identify the specific needs. And that can help to be integrated into the things that we can do around sexual health or mental health or whatever our fields are. So it's not so much about persuading them otherwise, but acknowledging the massive impact of the economic situation, of poverty, of lack of opportunity, of discrimination, these really wider systemic issues into the work itself, albeit with the caveats of what we can and can't do. And then focusing on where we can do, then how do we address those issues and how do we integrate that? So I hope that answers your question. It's a really important one and it comes up a lot. Families are very clear that the economic situation is the pressing concern for most people in the country.
Dr. Govender, would you like to add anything as well? We can't hear you. I think you're muted.
Yeah, I mean, I think this too, alongside, I think it also raises some of the ethical dilemmas, and the ethical issues rather than a dilemma. And I think, again, possibly, the question around how we engage really from the outset to better understand what are the economic or other challenges, particularly around economics, food safety, and what are the stakeholders, who are the other stakeholders that are present. I mean, in obviously, I think in humanitarian settings, you have a host of different agencies, partners, and the extent to which some of those needs can be addressed alongside. This, for me, is not necessarily so much about incentive, but I think it's more about engaging in much more a wider collaborative partnerships. And I think it's again, maybe speaks to the question around research, whether it's around refugees or in any other context, is how we have to be flexible, and also recognizing that the question around academic rigor, publication has to be balanced against what is policy relevant. And I think they do not have to be competing priorities, but I think there needs to be sensitivity that has to be built around that. And I think it's very hard to be able to obviously persuade people that one is more important than the other. But again, livelihoods are absolutely central. So if there can be more probably partnerships with other agencies alongside that might be able to address some of those needs, that would, because I think it would be potentially unethical, to be able to engage in research, in a very kind of a narrow, very narrowly, without recognizing the wider context in which people's lives are centered.
Thank you, Dr. Govender. We have another question from Lemise. Lemise is asking, would you please elaborate on ways that can protect the researcher in refugee-related research? Are there any specific certifications that need to be completed beforehand, similarly to the protection of subjects?
It's a great question. Maybe I can just answer from my experience that there's kind of two processes for protection. Firstly, that the university system there, I don't know of a specific, or certainly not a required certification specific to working with refugees, but they are a protected group on the standard forms and the standard application procedure that will immediately trigger a full board review, so that there's no kind of smaller expedited studies that are done in this population. All of them are reviewed, discussed at full board. So I think that's quite a stringent mechanism to ensure that research is thought through, to ensure that there's no exploitation and so on. But then the second thing is that as universities, we partner with some organization who works frontline with the population. And so we make sure to make quality partnerships with organizations that have ethical practice and will be a gatekeeper to access to researchers, will ensure that even before researchers go through an informed consent procedure, they're already informed about the research, they're giving permission to be contacted, they're ensured that they're reassured that it will have no impact on their access to services in that organization and so on. So those two things can be a good mechanism in order to protect refugees. Of course, it doesn't always work as well as it should, but I think those are the two main mechanisms, certainly that I've experienced.
Maybe I can just also maybe speak to the question around protection of researchers. And I think that probably would, that's a relevant question in all settings, probably more acute in refugee-related research. And it may also be, I think, probably even more of a challenge, maybe if researchers or, and I think I would expand researchers to basically even a field team, those who are responsible for much of the field work, whether it's through interviews, focus group discussions, etc., is how do we protect and safeguard them. And I think there's increasingly amount of focus on this as well. What I do see, and again, maybe it's something for us to think about it, is from some of the IRB or the ethic reviews that I've seen, there's often in protocols themselves, there's insufficient attention that's paid to the protection of researchers or the field team themselves. And that can be, and that's an excellent question, and that could be the role for an ethics review board. Is that should be included, and I've seen MSF has included that as in terms of their requirements, but that probably needs to be much more it needs to be standardized. Because that is often neglected.
Thank you both. We still have, sorry, you wanted to say something.
Sorry, go ahead, Dalia.
Thank you. So we still have only one more question from Hamdia. Hamdia is wondering to know how conducting research and knowing the results can help affect political authorities' mindset to prevent the conflicts which lead to sexual and reproductive health issues.
That's a great question. I'm sure Dr. Voloshny will answer better than I can. But I can just comment that it's an issue that I struggle with also in mental health, and the frustration of how working at an individual, family, even community level without impacting on the political and international level. And that's a very important point that we need to consider when doing research, and to be better at engaging at that level and preparing for it early on. And that's why I think that participation needs to also include some of those difficult things around not just working with the community, which is of course vital, but also working with those that have power to make changes in this area. And that's part of maybe how we need to think about participation.
No, I think 100% agree, Tanya. I mean, it's very much, again, when we talk about the design, and I think, rightly so, we focus here very much on refugees and as both the communities and as participants, but engaging with power at the outset, and that includes, for example, those in government, ministries of health, getting them on board, NGOs. And again, I mean, the objective of the research is to inform policy, to inform programs, and to improve the situation, the health outcomes, and address what might be the unmet need for services, and to build the evidence. So, and again, we conduct research and we support research, not just for publication, but for policy impact, for research uptake, to make a difference to programs. So engagement with policymakers, decision makers, those with power and those with influence, right at the outset, as well as part of kind of socializing them to why this research is important. And I think that itself builds, I think it's relationship building is key, particularly in all settings. But I think if those who are going to make the change, if they're not engaged from the outset, and find ways again, is how we communicate the research and how we communicate the findings is also important. They may not want to read a 40 or 50-page report, but they may want to see a one-page policy brief or a technical brief. So we need to be able to disseminate and speak to them in ways that we need to be able to communicate our findings and our research differently depending on who the audience is.
Thank you, Dr. Govinder and Dr. Bosky. So I believe we can wrap up our session for today as if we have no remaining questions. I would like to say thank you again to our speakers for their enlightening presentations and for sharing their extensive experience with us on these topics. I've already received positive feedback from participants. I would also like to thank all attendees for their participation. It was a pleasure to have you all with us, and we hope you have found this webinar both beneficial and engaging. Before we part ways, I just want to mention that we still have upcoming webinars as part of the series, and I'd like to encourage you all to stay updated on this by visiting our GHI website and following our page on our social media platforms so that you can sign up for upcoming events. And we would love to have you join us again. Also, for those who couldn't join, or if you know anyone that would like to watch this webinar, it would be available on our YouTube channel on GHI. Thank you again for your participation today, and we look forward to connecting